So we started lymphatic system and immunity. So in previous class we discussed about immunity. Okay, so we will continue the lecture here. So basically the immunity is divided into two sections. One is innate immunity and another one is adaptive immunity. So basically innate immunity is the first mechanism which will try to protect you, try to defend you, try to kill the bacteria, pathogen, any infection when it enter into the body. Okay. So basically, first mechanism is innate immunity. If immunity fails, the bacteria, the virus, any pathogen enter into your body, the adaptive immunity activates and it will try to make a perfect defense substance, okay, that is antibodies, okay, so which will kill the bacteria or virus or any pathogen. Then the antibodies remain there, and whenever the same infection will enter into your body, the antibodies will attack on those pathogens. But innate immunity is not specific immunity. It will try to kill, try to defend, try to protect, but after protecting, it will forget. It will unable to recognize the pathogen. Okay, same infection will come second time. Same sort of uh, defense will start from innate immunity. Okay, so let's discuss what are the different, what are the substances innate immunity have and how it will protect our body. We will discuss in detail in this class. So let's innate immunity. Innate immunity has several aspects: anatomic, physiological barriers, phagocytic and other defenses, and chemical secretions and reactions, including inflammation. So basically, it will start from here to here. Okay, from here to here. So basically, first is anatomically, structurally, it have the position. Physiologically, immunity, they have work, they will barriers to protect. And after that, we have phagocytic, means the cells which kill the uh, bacteria, anything. And after that, defense, protecting. Okay, and after that, we have chemical secretions also. If the bacteria will not able to stop, so it will release some chemicals also. The body will release some toxic substance, which will kill the bacteria. And after that, there is reaction. If the chemical and the bacteria will, if the chemicals are releasing from the cell, so there are also chemical substance present in the bacteria also. It will also release the chemical substance. So then what will happen? Then any reaction will happen. It will good reaction, it will bad reaction. Okay, like inflammation. Inflammation is the one of the best example of reactions. Okay, we'll discuss. The innate immunity response are always the same, and the degree of efficiency does not increase with repeated exposure. So I told you that if the same infection will come in the future, the approach is same because they doesn't have knowledge about the infection. The same infection will come, okay, and doesn't know how to start up and end up. It will start with the same formula every time. Okay. So basically we have barriers. Okay, barriers. Let's start with barrier. The stratum corneum of the epidermis of the skin is non-living and when unbroken is an excellent barrier to pathogens of all kinds. The fatty acids in sebum help limit the growth of bacteria on the skin. The living cells of the epidermis produce defense cells which are antimicrobial chemicals. The mucous membranes of the respiratory, digestive, urinary, and the living tissue. It's still a good barrier. Okay. The ciliated epithelium of the upper respiratory tract is an especially effective barrier. Okay. So basically, the barriers means protector. The main barrier of the body is skin. The main large organ which protect the pathogens. Okay, by entering, is the skin. Already we studied that we have the layer dermis, epidermis. Okay, in the epidermis, we have one layer which is non-living. Okay, so when it will have it is upper layer only. Okay, then what will happen? The upper layer will protect because it is non-living. It will not react with the living organism. So any pathogen will have difficulty by entering in the first barrier only. Okay, this is as well as we have sebum cells. Sebum, the oily substance. Okay, when we have when we have sweat, after that we see that they had us uh, the oily substance will uh, get into our hands. Okay, that is the sebum. Okay, so it will also protect because it will adhesive with the microbiome. Okay, with microorganisms. Okay. Next, the other barriers are like mucous membrane in the mouth, digestive system, unable to go the bacteria easily, like urinary tract, the reproductive system. These are also good barrier, but they are living tissues. Okay. And we have respiratory tract. In that we have epithelium, ciliated epithelium. This is also a good barrier. Dust and pathogens are trapped on the mucus. The cilia sweep the mucus to the pharynx and it is swallowed. The hydrochloric acid of the gastric juice destroy most pathogens that enter the stomach, either in mucus or with food and drink. Lysosome, an enzyme found in saliva and tears, inhibits the growth of bacteria in the oral cavity and on the warm, wet surface of that. The subcutaneous tissue contains many white blood cells, as does the areolar connective tissue below the epithelium of mucous membrane. Like other barriers in the mouth, we have, sorry, in the respiratory tract, we have ciliated epithelium uh, cells, which is like a comb. Okay, whenever dust, pathogen, anything will enter, it will like they are wiping. Okay, like in the like whenever you comb, what will happen? You will release the hair. Okay, you will release the hair. Okay. Then, like that, the respiratory tract have ciliated epithelium, which will release the all the dust pathogen from the surface. It is entering. Okay, it will give to the pharynx. Then it will enter into the if you swallow it will go to the stomach. In the stomach, we have hydrochloric acid, HCl. Okay, we'll discuss in digestive system. So that what will it will release? It is the gastric juice. Okay. After that, any bacteria will enter in the body. What will happen? It will crush. It will kill all the bacteria, even from food or drink. And in the tears, in the mouth saliva, we have lysosome. Lysosomes are also a protective organ. Okay. And in the surface, we have WBC also. So basically, these are the barriers which will stop the entering of bacteria, any pathogen. After that, what will happen if the cell entered by skin, by oral cavity, by wet, by any means, by urinary tract, by digestive system, by uh, respiratory. Okay, then what will happen? What is the next step? Defense mechanism. So basically, the defense mechanism are WBC. Which are the defense mechanism? WBC is the defense mechanism. Macrophages, both fixed and wandering, have receptors for the pathogens. Humans are likely to encounter this probably reflects millions of years of coexistence and very effective phagocytes. Others is capable of phagocytes of pathogens or other foreign antigens, or the neutrophils to a lesser extent. The eosinophils, pathogenic sites are used intracellular enzymes chemicals such as hydrogen peroxide to destroy ingested pathogens. So basically, we have defense mechanism. The defense mechanism is WBC. Okay. In the WBC, we have macrophages. Okay. Which will eat the microorganisms. So they will wonder, they will go all through the circulatory system and see whether any bacteria is there, how to attack on that, and how to kill them, and how to eat them. So their daily work is like that only. Okay. And in the skin, we have Langerhans cells. Okay, we studied about Langerhans cells. They are the dendritic cells through the body, also phagocytes. So they have work is phagocytes. Okay, but it will not destroy. So what will it will do? It will eat and it will take them to the lymph node because lymph node have lymphocytes. So then what will happen? This is the innate immunity. So Langerhans have phagocytic action. So they will eat the pathogen and it will take to them to the lymphocytes. From that, the adaptive immunity will activate. What will happen? The adaptive immunity activate. So this is the important thing we have to understand. Next, we have natural killers. So we have WBC, we have Langerhans cells, we have macrophages. Next, we have natural cells. This is also WBC and the WBC will circulate in the blood, but are also found in the red bone marrow, spleen, and lymph node. There is a small portion of the total lymphocytes, but are able to destroy many kinds of pathogens and tumor cells. Natural cells make direct contact with foreign cells and kill them by rupturing their cell membrane with chemicals called perforins or by inflicting some other kind of chemical damage. So here natural killers are there. Natural killers are like lymphocytes only. Okay, lymphocytes. They present in bone marrow, they present in spleen, they present in lymph nodes. So what their action is, they will not take the like macrophages. They will took the uh, they will took the uh, foreign body and it will take to them to the lymphocytes. Not like that. The natural killers they will kill. They will release any chemical substance. That chemical substance is perforins. What is that name? Perforins. What we need to do, it will damage the cell membrane. Cell membrane burst, then the life of the cell will clear. Okay. Next, we have basophils. Basophils, mast cells, a type of connective tissue cells are also defense cells. They are found throughout the areolar connective tissue. So basically, where that is found in our respiratory tract most. Okay, what will they produce? The chemical they produce is histamine and leukotrienes. Leukotrienes. Histamine causes vasodilation and makes capillaries more permeable. These are aspects of inflammation. So, in the market, we have antihistamine drugs like cetirizine, levocetirizine. So, basophils will act mast cells. They activate by the help of any what can I tell you that any allergic substance. Okay, dust, no dust allergy, anything. We didn't activate. Then basophils will release histamine to take away the dust substance from that area. So what will happen? The patient have sneezing, cough, okay, and running nose, watery eyes. Okay, these are the symptoms. So what will the allopathy doctor do? They will do antihistamine drugs to stop the releasing of histamine. Then what will happen? Basophils will release the histamine, but histamine will not work. Then what will happen? The sneezing, everything will stop. Okay. So what will histamine do? Histamine do vasodilation. The vessels will free. Okay, they have dilated. Okay. Then it is this is the reason of for inflammation. Okay. Then they have inflammation. Leukotrienes, then other substance also increase capillary permeability and attract phagocytic cells to the area. So then easily they will get that bacteria or pathogen from the area. So that's the reason they will, what will they will dilate. Okay, next we have chemical defense. So I think under defense mechanism and barriers. These are the two important things. Next we have chemical defense mechanisms. Then we complete innate immunity. So we have chemical defenses. Chemicals that help the body resist infection include the interference, complement, and the chemical involved in the inflammation. So we have different types of chemicals which will stop or will attack on the infection. Okay. So let's see what are the interference. What are the interference? Let's see. Alpha, beta, and gamma interference are proteins produced by the cells infected with virus and by T cells. So here the interference means they are the rates who produce the affected cell. So example, this is the liver cell. Any bacteria attack to the cells. So this infected cell will produce alpha, beta, gamma. Okay. Infected with virus and by T cells, T lymphocytes. Okay. With infected virus. This is the virus and this is the cell. So both will release these substances. Virus must be inside a living cell to reproduce. And although infectarian cannot prevent the entry of virus into the cell, it does block their reproduction. So what will here alpha, beta, gamma do? It will not, it will affect the virus for entry. It will stop the entry. It doesn't have entry here. Okay, interference. Okay, interference. It will stop the entrance. So virus. And virus will multiply only, then it will enter into the cell. Here the virus cannot be able to multiply. Okay, because they have the any path land to reproduce. So what will happen when viral reproduction is blocked? The virus cannot infect new cells and cause disease. Interference is probably a factor is the self-limiting nature of many viral diseases and used in the treatment of some diseases such as hepatitis C. So I gave the example of liver here, like example of hepatitis C also. So basically the viral infection cannot be entered into the other cells. It have to be entered into the cell, then only it will multiply and then it will affect other cells. Okay, so this is the basic physiology or any mm, mechanism of work of any virus. Next we have this the interference is the basic protector. Next we have complement is a group of more than 20 plasma proteins that circulate in the blood until activated. They are involved in the lysis of cellular antigens and the labeling of non-cellular antigens. Some stimulate the release of histamine inflammation, other attracts WBC on the side. So basically, they are the like wandering 20 plasma proteins. They are wandering in the body. They are going and walking. They are seeing. They are still until they are activated. They in the activated form only. So they observe. They see. Is there any uh, viral is there? So after seeing the antigen, it may be release the histamine first, or it will go to the WBC and it will say that some type of bacteria is there. You have to activate and you have to work on that bacteria. This is the second thing will happen. Next, we have inflammation process. So this is the very important process which will happen in the body anytime when you fell down, when you have any anything broken, when you have fever, anything, or running down, scrosy, anything. Okay. Inflammation is general response. It is a general damage of any kind, microbial, chemical, or physical. So damage of microbial microbes, chemical damage of chemicals and physical. Anything physical bacteria or our own Antibodies are damaged. Basophils and mast cells release histamine and leukotrienes. I told you that basophils and mast cells, which affect blood vessels as previously discussed. They do vasodilation. Vasodilation increases blood flow to the damaged area and capillaries becomes more permeable. Tissue fluid and WBC current at the site. The purpose of inflammation is to try to contain the damage, keep it from spreading, eliminate the cause, and permit repair of the tissue to begin. So basically, what is the purpose of inflammation? So vasodilation bring more blood have more WBC and other substances, so which can heal that area very rapidly, and the infection will not go to the other side of the body. So this is the main purpose of the inflammation. When you have inflammation in that area, you have to remember that easy. Nicotin and histamine, which is basophil and mast cells. So, what are the signs of inflammation? There is redness whenever see, and the heat and swelling and pain. Why the redness? Redness from greater blood flow. So because of blood flow, heat from the blood, because of the heat, more blood is coming, more heat is coming. Greater metabolic activity is happening. Swelling from the accumulation of tissue fluid, because the tissue fluid is more, so the swelling is there. And pain from the damage itself. Okay, why the pain? Because of the damage. So here four reasons why we have inflammation because of the histamine and liquids. Okay. Next, inflammation have four signs: redness, heat, swallow, and pain. Redness, heat, swelling, and pain. Why the redness is there? Because of the large blood flow. Okay. Why there is the swelling or heat? Because of the blood. Blood have the temperature. So blood will doing more metabolic activity. Why there is swelling? Because of uh, we have tissue fluid. Okay. Accumulation of tissue fluid and pain is for damaged tissue. Okay. The hormone cortisol is one break that prevents this. At least one of the complement protein that has the function as well. There are probably other chemical signals, cytokines and chemokines that help limit the inflammation to extent that is useful. So basically, if the pain is if you got any injury here, the inflammation is present that area only because of the cytokines and chemokines, which will uh, protect the uh, what will happen the spreading of inflammation. Okay. So basically, this is the mechanism of innate immunity. So we have barriers, like different barriers we studied, and we have defensive cells, natural killers, mast cells, basophils, macrophages, WBC, Langerhans cells, and like that. Then we have defense mechanism, interferons, complement, inflammation. Inflammation is very, very important. You have to remember that. Okay, we can see that this is the barriers. Integumentary system, we have Langerhans cells. Okay, we also different barriers like liver and defensive. Stratum corneum, this is the upper layer. We have WBC here, and we have hydrochloric acid. This is the in the upper respiratory tract of our ciliated epithelium, in the lacrimal gland, sweat gland, sorry, eye gland, tear gland, salivary glands have lysosomes. Okay, Langerhans. This is like okay. It will take the antigen, it will go to the lymphocytes. Your macrophages will attack on the bacteria. WBC. Please note this. This is the natural killers, perforins, which will damage the bacteria cell membrane. And lymphocytes, it will activate. The Langerhans will activate lymphocytes. Basophils and mast cells will release histamines and leukotrienes. And we have interferon. So this is the interferon. This is the cell by entering of the viral, which is blocking. Okay, T cell is there. Complement. This is the attack of liposomes on that bacteria. Inflammation. You can see that histamine and leukotrienes making the vasodilation, capillary permeability, tissue fluid is increasing. Okay, damage cell is there, the pain is there, redness is there, metabolic activity increase. So these are the things we have to understand. The big diagram will help you a lot. So please remember this diagram and you have to draw this diagram. So this is very, very important. Whenever infection is entering, what happens? Barrier is there, defense is there, and chemical reaction is there. Barrier is there, defense is there, and chemical reaction. So this is the three steps process of innate immunity. Next, you have adaptive immunity. We will discuss tomorrow because it is very big chapter and as well as very important. Okay, very, very important. If you have doubts, you can ask.